Cardiovascular or heart diseases are the #1 cause of death globally, taking an estimated 80 million lives each year. This makes their prevention or treatment a very active area of research. One such recently developed treatment is an ultrasound device used to fragment calcium deposits in narrowing arteries. This technique was recently used in the National Cardiology Center at the Royal Hospital to perform 2 successful operations on patients suffering from hardening arteries due to calcium deposits.
As part of atherosclerosis process, which leads to narrowing of the coronary arteries, what you will get sometimes is, especially in the elderly, diabetic patients, and maybe patients with renal insufficiency, you can get calcium deposition in the walls of the artery. And this is very difficult to fracture, and it poses a major challenge when we try to open the artery and put a stent and expand it well. And the end result of that is more complications. Less expansion of the stents will lead to future heart attacks and so on. So we want to avoid that, and we have several technologies that we are using. This is the newest of them. It's a very new technology and very promising, very successful. So we use lithotripsy. This technology was previously used for kidney stones, and now it has been developed into a catheter that we can use for arteries. Initially, it was used for peripheral arteries, and now, like a few years ago, they moved to coronary arteries with improvement and more fining of the techniques and so on. So now it's very safe, and we are using it. We did 2 cases here at the National Heart Center, very successful, and we are very happy with the result and the outcome of the intervention we have done using this technology.
This novel treatment is extremely useful, particularly for cases where usual fragmentation techniques are not possible.
We used this balloon in one of our patients. He was very old, and he presented with acute myocardial infarction. And he was having 2 lesions. One was very calcific, and the other was less calcific. We treated that one less calcific, but the other one didn't open with the usual balloons. So we gave him another appointment, and we brought this technology, and we used the lithotripsy balloon for opening this lesion. The lithotripsy helped us to fracture this calcium, and it opened the artery well, and we were able to put a stent, and the patient was very okay and discharged safely from hospital.
It is noteworthy that carrying out these rare and advanced operations came as part of a strategy to develop capabilities and apply the latest international medical systems and services in the field of cardiovascular diseases. From 1987, the Royal Hospital continues to provide leading medical care in the Sultanate. The successful operation of intravascular lithotripsy in the Sultanate for the first time is evidence of this. From the Royal Hospital, Ahmed Mahmoud Hinai, Muscat.